It is with great joy that we welcome Laura Jones with us today to be a speaker. She came to WVU 34 years ago, and she loved the state so much she stayed. She's married to Sam, and they share their home with 5 rescue dogs and 3 rescue cats. Over the last 25 years, they've taken in more than 60 cats and dogs that have had medical and physical problems that made them difficult to adopt. She hasn't told us her age, but she said she started kayaking when she turned 50. And she's loved her chosen path in life as a social worker, and she approaches it with more passion than as a career. And she's been with HealthRight for 15 years. She attends First Presbyterian Church, and we welcome her at our church today. Thank you, Laura Jones.
Thank you so much for having me here today. It's a great honor to be with you. And everything about the service so far has really touched my heart in relation to what happens at HealthRight. And so before I tell you a little bit more about HealthRight, I want to tell you that tell you a little bit about our mission. If you just hear our basic concept of what we do, we basically provide health care to people who don't have access to care. But if you come to HealthRight and you meet the people that work there and you see the work that we do, you know that we are working toward being, as the song said, a touching place. Our mission is to advocate and speak for people who don't have the ability to do that on their own. Those folks who often are not listened to are seen on the fringes of our society, even in Morgantown. And we provide that care with the utmost in non-judgmental processes. Our goal is to accept people where they are at the moment and then work with them to move in the direction that they want to move in. It is not an easy task, and there are some difficulties. We get a lot of stress sometimes from the community in Morgantown because we are seen as part of the problem that attracts people that no one wants to see on the street. We are a community-supported clinic, and when we say community, we mean all community. In the morning, every morning, we have coffee available for the 40 people in our community who are currently living on the street, this is called rough living, and it's absolutely rough living. We're not talking about camping. This is not something that people do because it's fun. They do it because they have no alternative. We have coffee in the morning, and we invite everyone in the community in for coffee. And during that period of time, we have a case manager, social worker person who sits in the waiting room and talks to people about what happened last night. Were you warm enough? Did you get hurt? Do you know of anyone who got hurt? Do you know of anyone who should be here but isn't here? Is there anyone you haven't seen in a while that we need to go look for? Those are actual questions that we ask people because we believe, and I firmly believe, that if Morgantown is an inclusive community, it has to include everyone. So as part of our inclusiveness at HealthRight, we take a whole person approach. It would be very easy for us to just provide primary health care and patch things up, give people medicine, and send them on their way. But we are concerned about whether or not they have housing, and we assist them in finding housing. We're concerned about whether people have enough food, and we assist them in finding food. We assist them in all the essential basic things that people need to feel safe in order to move forward. If you don't have your basic needs met, it's impossible to move forward. So we take the approach that you do not have to meet criteria. You don't have to stop drinking. You don't have to stop using drugs. You don't have to follow your diabetes health plan before we find housing for you. We want you safe and warm with food, and then we will tackle all of those other issues. And we work with a community of other agencies that are pulling together and beginning to respond in the same way. Healthcare is housing, healthcare is food, healthcare is clothing, healthcare is mental health, healthcare is spiritual health, healthcare is social relationships. One of the things that happens to us at HealthRight is that we become temporary family for people who don't have anyone to tell the good news and the bad news to. Not all of those folks are homeless. Some of those folks have housing, but they don't have a support network. And so at any given time during the day at HealthRight, there will be someone at the front desk who is telling whoever is in our little front desk area some important bit of information that's important to them that they need to share with someone else. Sometimes it's a joy and sometimes it's a sadness. Most of the time we find a way to help meet whatever need or concern there is. And a lot of times it just means that we find somebody to sit in a room and listen more intently, or hug or cry with them, or whatever is necessary. There's a whole lot more going on than the list of things that we do as a community-supported free clinic. We do so many things right now that I actually had to make a list this morning so I wouldn't forget anything. The Affordable Health Care Act has temporarily rocked our world to some extent. We would love to be completely out of business because we had universal health care. But unfortunately, fortunately, we have the Affordable Health Care Act, which is a step in the right direction. It is not the be-all, end-all to health care. We have now many, many people who have Medicaid cards, but still lack access to care. We did not initially believe that HealthRight was going to move into seeing Medicaid patients because we felt that that might be veering away from our mission. But after a year and with some pressure from the state, we decided that it was in the best interest of our clients to make sure that we are able to see them if they have a medical card. So we're now seeing both uninsured and insured folks at our clinic. They all they have to be 250% below the federal poverty level. And if people are a little bit over that, we encourage them to call anyway. We try to provide service rather than keep people out, which is a little bit different than your typical human service agency. Our goal is to make sure people are healthy in our community, so we do what we can to make sure that we can provide services to people. Aside from primary care, we provide free medications. We have a full mental health counseling and case management program. We make dental referrals. We have a community of about 15 dentists that provide free care to our patients. And we also certainly have the WVU School of Dentistry. That's a huge help to us. Despite that, we still have 500 people on a waiting list all the time for dental care. And the wait is years, not months. All of our dentists provide care for free, so they can only take one or two at a time. And so many of our folks that need dental care have not had it for so long in West Virginia that when they come, it's not just a cleaning and a cavity filling. It's 6 visits that can run from anywhere from $600 to $1,000 by the time all of the things are done that they actually need. We're advocating on a state level to try to change that, to somehow get dental care added to Medicaid in West Virginia. But given the current budgetary constraints, it's doubtful that that will happen anytime soon. Not even a basic plan that will allow for cleaning on a regular basis. We now offer vision care. We have a full vision screening clinic, and we're getting people glasses. The greatest thing that can happen at HealthRight is for someone to come in a poor state of health, and for us to be able to restore them to health and get them everything they need in order to be back in the workplace, or be in the workplace for the first time, so that they can actually get health care from an employer maybe, or find other ways to get their needs met. And so glasses are an important part of that. We have so few adults, low-income adults, that can afford the optometry visit and the glasses, that we have people who are trying to find jobs and they actually can't see well enough to read or use a cash register. And so by working with the local Lions clubs, we've been able to raise some money, and we've also worked with the WVU Institute, Eye Institute, and we have some very generous optometrists and ophthalmologists that volunteer at our clinic, and then they're able to get glasses for people for $10. And no one leaves without glasses. If they don't have $10, then HealthRight will pay that fee. We have several other cancer screening programs, and we have a very extensive, as I said before, outreach to our homeless community. So what has happened essentially, you may have seen some articles in the paper recently, is that the state has decided, West Virginia DHHR and the governor have decided that now that we have the Affordable Care Act, everyone has access to insurance, and therefore there shouldn't be anyone without insurance, and that the need for free clinics is no longer necessary. And so the states for many years, rather than expanding Medicaid, basically put a small amount of money into a fund to keep 10 free clinics running to see the folks that didn't have insurance. And now within 1 year they decided that 32% of our funds are no longer necessary. And then after the legislature made the 32% cut to our line item, 9 clinics currently share for $4 million, did share $4 million. And now what has happened is that they have not only cut the overall budget by 32%, but then they looked at, they came up with a formula without discussing it with the free clinics, and basically said that some of you are seeing fewer people, so we're going to increase your cut. So our HealthRight got a 49% cut in 1 year to our funding. Most companies with any kind of business model would not be able to recover from that. The good news is that those of us that have been watching what's happening at the state level realize that there's a possibility that something serious like this could happen, and our free clinic spent a great deal of time trying to figure out how to prepare for this kind of a cut. So we are okay for this year. We are going to operate at a deficit, but we don't totally know the extent of that yet, because we need to wait to see how our Medicaid billing will come through. The state believes that if free clinics bill Medicaid, they will be able to recoup the amount of money they lost. And this is absolutely not true. Private physicians can only see about 3% Medicaid patients and still keep their head above water. So the task they've given us is impossible without community support. And essentially what we need to be saying now as a HealthRight is that if our community believes that this is important, and we think they do, we have good support, we're going to have to, everyone's going to have to step up to the plate and help us figure out how to keep things going. We have done everything in our power, as funds are dwindling, to figure out how to pull in more funds. And we have expanded at the same time we're losing money. With grants and other things that are going on that are important gaps in our community, which is what we really believe is our role. not only to create access, but to create a response to gaps in our community. So a couple of the gaps that we have stepped into include community engagement. And this is a program that helps us help folks who have been hospitalized for psychiatric issues. And our goal is to prevent them from having to go back to the hospital in the future. We have, in 3 counties, we're working diligently with about 30 clients right now who have been repeatedly hospitalized for psychiatric issues. And our goal is to try to stabilize them and keep them in the community. So far, it's working. We have had a couple people who have to go back to the hospital, but we're actually looking at the reality that some folks, if we can stretch the amount of time between hospitalizations, that is success for them at this time. We also, very soon, will start the Right from the Start program, where we will reach out to, and we're already doing this, but this will be a funding source to help pay for working with young women or women of any age who happen to be pregnant and who are at risk, either at risk through relationships or housing issues. We have folks that are pregnant and homeless currently, and we will do everything we can to help make sure that they are healthy and the baby is healthy, and then we will follow them for a year afterward to make sure that the baby is making progress and the mom is getting her needs met as well. We also have a partnership with a sorority called Alpha Phi, and they raise money every year through their Red Dress Gala for us to provide women's heart health education. And then together we work on a group project to use that money to help with women's heart health education. And next week we have the very first Heart Healthy Family Fun Night, which will occur at Skyview Elementary School. They have the highest number of low-income kids in the county, and we will be going there to have a half hour of healthy exercise, a half hour of a healthy meal, and then an hour of games that are all designed to teach moms and kids, and the whole family's invited, dads too, to help them learn about heart healthy activities. Hopefully fun, lots of prizes. So we're looking forward to that. And probably the most difficult group that we've reached out to, certainly a group that others often shun or misunderstand, is through our harm reduction syringe exchange program. West Virginia ranks number 2 in hepatitis C, number 1 in hepatitis B, and this is primarily due to the extreme opioid addiction that's going on in our communities all across West Virginia. Morgantown is no exception. It snuck up on us in a big way, and we are in a number of states around us that do not have syringe exchanges that have extremely high rates of hepatitis C. For every 100 people in West Virginia, there are 143 opioid prescriptions written every single year. And this is an amazing statistic that has caused a domino effect, and we're now seeing an increase in heroin use and people who are melting down opioids and injecting them. And it's that sharing of needles that causes such extreme other extreme illnesses. It's been 8 weeks since we started our program. We have seen 67 unduplicated people during those 8 weeks. We've provided countless syringes, and what we have discovered is that all of our stereotypes, and you would think maybe we wouldn't have as many as other people, but we certainly did have some stereotypes about who are the folks that are injecting drugs. And amazingly, they've been largely women. Many of them are people who have been prescribed opioids for legitimate surgeries or pain or other illnesses and are now addicted. There's a lot of crying. that happens. People know that this is a bad situation for them and they're looking for a way out. The Charleston Gazette reported this morning that WVU Medicine opened a hotline for people to call in and say, I need treatment for opioid addiction or other addictions. And within 1 month, that hotline has a year-long waiting list of people who need treatment. There is no treatment right now. And so harm reduction is the next best thing we can do as part of an overall plan to try to help people. The newest research is that addiction is a brain disorder. And so we're looking at people who are really struggling to deal with something that is impossible to deal with without help and guidance and understanding and love. We had a therapy dog come to one of our syringe exchanges, and it was the most amazing experience I've ever had. A young woman came in and sat way off in a shadowy corner of the waiting room, and she had a look on her face, no affect whatsoever. And the person in their therapy dog came in and sat at the very long, far end away from the waiting room. And the dog did a few tricks, and somebody started talking to the dog and the owner. And the next thing I know, this young girl came out of the shadows and sat closer to the dog, and still no affect. And then the woman with the dog spoke to her, and the girl smiled, and we had discussion and caring, and that is a touching moment, a touching place. The people that come to our harm reduction clinic say to us over and over again, thank you for being nice to me. Now we feel like we're pretty nice most of the time, unless somebody's having a bad day occasionally. But I realize that the message within that is that people are not normally nice. People are not nice when they find out you have a drug addiction. And so we're really hoping that by having this non-judgmental, open, loving place for people to come, to learn how to protect themselves and take care of themselves, that will encourage them to see some hope for change, that we can help them move in that direction. So that's pretty much what we're about. And I hope I haven't spoken too long, but I certainly appreciate your attentiveness.